Leptospirosis is a bacterial infection. It can make people very sick. The bacteria that cause it are called Leptospira. These bacteria live in animals. Animals that carry Leptospira include rats, dogs, and livestock. Humans get infected through contact with the urine of infected animals. This can happen directly or indirectly. Indirect contact means coming into contact with contaminated water or soil. Leptospirosis is a serious health concern worldwide. It's important to understand how it spreads and how to protect yourself. Leptospirosis spreads through contact with contaminated environments. The bacteria live in the urine of infected animals. These animals can be wild or domestic. Common carriers include rats, mice, dogs, cattle, and pigs. When infected animals urinate, the bacteria contaminate water and soil. Humans can get infected through cuts or abrasions on their skin. The bacteria can also enter through the mucous membranes of the eyes, nose, and mouth. Activities that increase the risk of infection include swimming or wading in contaminated water, working with animals, and coming into contact with floodwater. Leptospirosis symptoms vary widely. Some people have no symptoms at all. Others experience mild flu-like symptoms. These symptoms include fever, chills, headache, muscle aches, and vomiting. In severe cases, leptospirosis can cause life-threatening complications. These complications include meningitis, liver failure, kidney failure, and respiratory distress. Symptoms usually appear within 2 to 4 weeks after initial exposure. It's important to seek medical attention immediately if you suspect you may have leptospirosis. Section 4. Diagnosis and treatment. Seeking timely medical care. Diagnosing leptospirosis involves a combination of tests which are crucial for accurate identification of the disease. Doctors consider your medical history, including any recent illnesses or symptoms you may have experienced. They will ask about potential exposure to contaminated environments, such as contact with water or soil that may harbor the bacteria. Blood and urine tests are essential to confirm the diagnosis, as they help detect the presence of the bacteria. These tests detect the presence of Leptospira bacteria or antibodies produced by the body to fight the infection, providing a clear diagnosis. Treatment for leptospirosis typically involves antibiotics, which are effective in eliminating the bacteria from the body. These medications help kill the bacteria and prevent complications, ensuring a quicker recovery. In severe cases, hospitalization may be necessary to provide intensive care and monitor the patient's condition closely. Patients may receive intravenous antibiotics, fluids, and other supportive care to manage their symptoms and support organ function, ensuring the best possible outcome. Section 5. Preventing leptospirosis. Protecting yourself and your community. In this section, we will explore various measures you can take to protect yourself and your community from leptospirosis. Preventing leptospirosis involves avoiding contact with contaminated environments. This means steering clear of areas that are known to be contaminated, especially during and after heavy rains or floods. This includes floodwaters, stagnant water, and areas where rodents or other potential carriers may live. Rodents are a common carrier of the bacteria that cause leptospirosis, so it's crucial to manage rodent populations around your home and workplace. Wearing protective gear is crucial, especially for individuals working in high-risk occupations. This gear acts as a barrier, reducing the risk of infection when coming into contact with potentially contaminated water or soil. This includes farmers, veterinarians, and sanitation workers. These professionals are often exposed to environments where leptospirosis bacteria may be present, making protective gear essential for their safety. Protective gear includes waterproof boots, gloves, and goggles to prevent contact with contaminated water or soil. Ensuring that all parts of the body are covered can significantly reduce the risk of infection. Vaccinating pets and livestock can also help prevent the spread of leptospirosis. By keeping your animals vaccinated, you reduce the risk of them contracting and spreading the disease. Vaccines are available for dogs and livestock. These vaccines are an effective way to protect your animals and, by extension, your community from leptospirosis. It's important to consult with a veterinarian to determine the appropriate vaccination schedule for your animals. Regular checkups and timely vaccinations can make a significant difference in preventing the spread of leptospirosis. Section 6. Real-life scenarios. Understanding the risks. Imagine a group of friends going on a camping trip. They are excited to spend time in nature, setting up their tents and enjoying the fresh air. They gather around a campfire, sharing stories and laughter, completely unaware of the hidden dangers that might be lurking nearby. As the day gets warmer, they decide to cool off by swimming in a nearby river. The water looks inviting and refreshing, and they eagerly jump in, splashing and having fun. Unbeknownst to them, the river is contaminated with Leptospira bacteria from animal urine. This bacteria can be present in water that looks clean but is actually hazardous. One of the friends has a small cut on their leg, a minor injury they got while hiking earlier. They think nothing of it as they continue to enjoy their swim. However, the bacteria enter their bloodstream through the cut. This seemingly harmless swim has now become a potential health risk. A few weeks later, they develop flu-like symptoms that worsen over time. What started as a fun trip now turns into a medical concern as they seek treatment for their illness. This is a common scenario where leptospirosis can occur. It highlights how easily one can be exposed to health risks in natural settings. It underscores the importance of being aware of potential risks, even during recreational activities. Always take precautions and be informed about the environment you are in. Always choose designated swimming areas and avoid contact with stagnant water, especially after heavy rainfall or flooding. By being cautious, you can enjoy your outdoor adventures safely. Section 7. Conclusion. Staying informed and safe. Leptospirosis is a serious but preventable bacterial infection. Understanding the causes, symptoms, and prevention measures is crucial for protecting yourself and your community. By taking simple precautions like avoiding contaminated water, wearing protective gear, and getting your pets vaccinated, you can significantly reduce your risk of infection. Remember, early diagnosis and treatment are essential for preventing complications. If you suspect you may have leptospirosis, seek medical attention immediately. Stay informed, stay safe, and enjoy the outdoors responsibly.